to wake up to a phenomena where UroLift is doing wonders to a lot of young men where the complications were feared about. So no sexual problems, no incontinence issues. The prostate gets opened up by the clips applied, which could be anything between 2 to 4 to 6 clips, which opens up the prostate completely, and the prostate opening is widened up. This widening of the urinary passage, it was traditionally done by TURP and by HOLIP, which we continue to still do. And therefore we look at right approach to a right individual when we use the UroLift. So for individuals who are taking medicines and the urinary flow is not good, the prostate is between 30 to 80 grams. For individuals in whom the prostate cannot be treated because they are of very high risk of cardiac and other neurological issues, but they cannot go to operation theatre. There are many young individuals who don't want to lose their sexual issues and concerns of sexual issues by a TURP and by a HOLIP. The minimally invasive surgical treatment of UroLift has done wonders. At the Kokila mein Dhirubhai Ambani Hospital, a wonderful approach to a lot of young men who have actually had urinary complaints and were probably taking medicines, not getting treatment, running from pillar to post, and were worried about their sexuality, the ejaculation, erection. A thumbs up came when we did the last thumbs up on 12 to 14 minutes of this kind of a treatment where we use disposable clips and open up the prostatic urethra. So friends, the prostatic urethra is wide opened up. The urinary passage opens up. The urinary flow becomes again good, what we were aiming for. And that's the way we continue to improve on the urinary flow. Because men progressively continue to have trouble. And this trouble is not unknown. So friends, if we always do what we always did, we'll always get what we always got. It's important to wake up to newer treatments and the right approach to the right individual. I'm Dr. Sanjay Pandey from the Department of Urology at the Kokila mein Dhirubhai Ambani Hospital in Mumbai. It is important for me to make all men in their 50s to 80s aware that today a treatment is available in many ways. It's a doctor who decides what treatment is safe for you, best for you and long term. Over the last 3 years of a 15 years established therapy in UroLift, we've been happy to treat a lot of young men, a lot of middle-aged men, a lot of elderly men whose urinary catheter was not removed, whose urinary obstruction was significant, who were high risk for cardiac surgeries and neurological issues, who were very young men and were worried about their sexuality, and in whom the medicines was not working. So minimally invasive surgical treatment is a reality. It is something which has got established, and let's take it forward to the highest possible level at the Kokila mein Dhirubhai Ambani Hospital. Thank you.